Bonjour tout le monde. So let's get started. I'm going to give you a bit of an overview. I've got a lot to present today, but give you a bit of an overview of a few things that are going on. Number one, just to quickly go over our provincial numbers. We're up to 928 between yesterday and today, and what we're seeing a slight, a sort of a trend, weekly trend, week to week, driven mostly by peripheral health units, more in the north. But again, overall, in terms of deaths, that's been stable. Most of the cases provincially are among the non-vaccinated, and that number of non-vaccinated percentage gets higher in hospital and ICU. You could see that our hospitalizations, for the most part, are stable to 300 or so. They're a bit up. They're inching upwards. ICU just slightly up as well, but kind of stabilizing down in that trend. Long-term care facilities, again, after our third dose, we've calmed things down again, which is good. This is just the latest one from the table where the advisory table, where again, we're looking at health units that have undergone increases over the last 14 days. We are among those, but we've had a very big outbreak with subsequent community cases. That's why we've had that, and it's more localized in our area. Had it not been for the outbreak, we would have been in this category here. In terms of, this is just looking at partially vaccinated and fully vaccinated down here in green. So clearly the rates among the non-vaccinated are much higher than the rates among the vaccinated. And that's what we want to see. The risk of getting the infection is much higher if you're not vaccinated versus if you're vaccinated. This is the latest data that shows you, again, a big difference in terms of cases. This is from the science table released today. The cases among the unvaccinated are quite high as compared to those who are vaccinated. And again, you're seeing the same differences both in hospitalizations and in ICU occupancy. And again, over a 23-fold high risk of hospitalization in the ICU if you're not vaccinated versus if you're fully vaccinated. These are the same trends. Again, the vast majority of cases, hospitalizations, and deaths are among the non-vaccinated. Let's go to our local data right now. We've got a total of 89 active cases. We have 3 hospitalized and 1 in the ICU. That just changed. All 3 are not fully vaccinated. If you're looking at our cases, 89 cases, I'll talk a bit about those as well. Most of the active cases, like I said, are due to an outbreak that we've had, a major outbreak in a manufacturing plant. And so you can see around the SDNG Cornwall area, and you can see we've added 15 today, mostly in the SDNG and Cornwall area. And again, most of these are related to the outbreak. And so you could see here that we had a big push last week, again, both in Cornwall and SDNG, which is the gray here. And those are reflective of the outbreaks where we've had 41 positive workers, and that spawned over 35 community cases, close contacts at home, most of which of those cases that got it at home from the workers were not vaccinated. In fact, 84% were not vaccinated, and again, it varies in age range, and I'll show you. So you can see that these numbers are really pushed up more by the outbreak that we've had, and then they're stabilizing. So hopefully we'll get more stabilization over the next couple of days. This is just a breakdown, and you could see here that over the last month, about 41 out of our 281 cases were in children less than 5 to 11 years of age. And again, the reason I say that is because we're now vaccinating these children, so that just by that we'll be able to prevent cases. But you could see the majority of cases are between, almost 95 out of the 281 cases are among individuals between 18 and 39. And as you'll see below, it's not a coincidence, particularly the 18 to 29-year-olds are among the least vaccinated. If we look at our cumulative, we're about 2/3, 1/3 of cases. Most are not vaccinated and vaccinated here just over the last month. Again, we're going to be doing some cumulative data, but it looks like anywhere between 25 and 30% are vaccinated, and about between 65 and 75% are not vaccinated. It depends on the day, so we need to sort of get cumulative data. This is cumulative data for the cases that we had in November. If you look at positivity, provincially, it's gone up to 3.8%. We're a bit lower overall, but we do have pockets of the population that are higher, and that's driven by the actual outbreaks that I mentioned to you about. We have here our effective reproduction number, which is 0.99. And again, just to show you, we were sort of hovering up and down, and this, you could see this is where we had the peak in the fall. And then we had sort of increasing again. This represents the current outbreak that we had. And right now we're back down to 0.99, which is good. We want to keep it below 1. That's an indicator of less community transmission, whereas if it's more than 1, it indicates that there's more transmission in the community. This is, again, another index that we use, and you can see that the gray line is the number of cases in Cornwall. The orange line here is the number of cases in Hawkesbury, which is flat now. And the blue here is the markers, is the wastewater levels of COVID. And you can see that in September it peaked, and then it kind of started peaking again, which coincides with our outbreaks that we had, and the cases went up again. And it's relatively smooth in Hawkesbury at this point. Again, a quarter of our cases were in school-age kids, 4 to 18 years of age, less than we had in August and September, but still an increase as compared to October. Again, this was driven by those outbreaks that we've had. And as I said, there was close to 35 cases, if not more, that were directly contacts to the outbreak workers. As a result, our positivity locally has gone up a bit, but it's about 3% right now over a 7-day average. And again, that is driven primarily by this area here in the Cornwall SDNG area, where we have higher rates of positivity as compared to the rest of our area. Again, explainable because of the fact that we have those outbreaks. And the people that we tested, we had a high suspicion that they would be positive anyway, because they were living with they were unvaccinated and living with individuals who had it. At this point, we don't have any indication that that is Omicron. I know that somebody might ask us that. I asked. So far, it looks like it's Delta, but we're always looking out in surveillance. But so far, we don't have that, and we haven't had any Omicron cases in our area. But I asked to look in this because of the many cases that were spawned by this. Again, Delta behaves like this as well. So so far, all indications are that this is Delta as well. In terms of our vaccination rates, again, we're doing a bit better right now. We're looking at we reached the 80% mark of 12 plus among those higher risk areas. Yeah, it's still lower than our average. And if we look at the second dose, again, we're sort of approaching, the above 75, closer to 80% in all those areas as well. You'll note that our numbers are a bit lower. We had before it was 12 plus, but now it's based on a population that's a bit bigger, 6 to 7% bigger. And so that's why the numbers are there. And then moving forward, the numbers that we're going to be reporting in terms of vaccination status will be 5+ population in Ontario, which for us is the total 5+ population is about 205,000, which includes that includes I had the number because I want to be accurate. Yeah, 205,000. That includes the 5+, and that is based on the 2020 Stats Canada projections, which are now being used to replace the previous numbers that the ministry were using, so we can get more accurate data. Again, right now, although we have cases in schools far less than we had a couple of months ago, we are now we have no outbreaks. Again, the exposure is more household and community, not in classroom for the most part. Most of our cases, again, in schools are among unvaccinated individuals. And speaking of vaccine, right now, this is where we are right now. So basically, we're at 171,690 first doses, and that's about 84% of our population. That's 5+, and about 80% second dose, and again, about 18.9% third dose. And that's the reason, because of that, is because our 70+ population, a lot of them have still not reached the 6-month point. They will be reaching that 6-month point over the next couple of weeks, so we should see a big bump in that. So If we look at our trends here, you can see again, I mentioned that our highest number of cases were among the age group of 18 to 29, which is the least vaccinated. We're over 80% to 12 to 17, and that's increasing steadily. And we're now at almost 17% of our 5 to 11s after 1 week, really. We started a week ago Friday. And so we're going to continue, and I'll give you a bit more details on that and how many exactly that represents. If we look at our total numbers again, you can see our patterns of all our vaccines, and you can see that we're starting to increase, which reflects third dose and 5 to 11 launch. This is our first doses, and again, you can see that we kind of flattened here in October, November, and then we're up again. And again, this reflects mostly our 5 to 11s. If we go to our second dose, it's the same. It's kind of flattened here. We want to encourage people who have got their vaccine, 8 weeks ago or more, first dose, go and get your second dose. Very important to do that. And then if you're looking at our third dose, we're up to 10,622, and you can see it's going up. And as I said, that represents, again, a lower percentage of our population. That's because, like I said, most of our individuals were vaccinated. They received their second dose towards the end of the summer, and it doesn't, and it'll bring them, 6 months will bring them into next month or later this month. So that's why. The other thing too, in terms of children, right now as of yesterday, we have administered 2,750 doses. That's about 16% of our population. Our population of kids is 15,000, and you could see the orange one are school clinics. We had a great school clinic over the weekend, both in Iroquois and in Russell, where we had over 310 children vaccinated walk-in. These are both walk-ins, and we have those every weekend, and we have clinics almost 7 days a week available to our community at various locations among the Eastern Ontario Health Unit. This is something that I just want to repeat again. This is, again, data that shows that the blue line is, and the blue and yellow show symptomatic infection or asymptomatic infection, and the protection that the mRNA vaccines give you. And you could see that around 6 to 7 months, it starts falling down. It starts falling down to about 70% and 80% for symptomatic infection, but it kind of stays steady even to 8 months for hospitalizations or death, and that's what we want to do. We want to prevent that, but you do see there's a bit of a decrease in the cases, and that's why we're seeing now some increase among breakthrough cases, but they don't end up in hospital. And it's more exacerbated in older individuals. I've shown this before, but again, it's worth repeating. But they start waning earlier, and a lot of them start off less vaccinated, less protected because of their perhaps a weakened immune system because of age. And so that's why we vaccinated the 70 plus, particularly in the long-term care facilities and retirement homes, where we haven't seen any issues. And I'm anxious to get the 70 plus done as well, because now is the time to do that, although they're still protected against severe disease. But we do want to, we know that it's going to wane, and we've seen other countries where it's waning, and inevitably we're going to need to vaccinate most people with third dose, but that we're going to stagger that, and I'll explain that a bit later. So basically, the latest modeling showed that most of our cases are Delta, and we knew that, and the modeling was really based on Delta, and Omicron is kind of an afterthought because this was done kind of based on the Delta. It will show that there might be some ICU occupancy increases, and that we need to basically increase our vaccination, particularly among 5 to 11 years old, and continue to use public health measures to reduce transmission now. And that's important. That's an important message. So now's not the time to remove restrictions. Now's the time to start getting vaccinated optimally. As I've said before, these are the projections, even without Omicron here, that depending on if you have 15% decrease in transmission through additional measures, i.e. decreasing the number of contacts you have, and us vaccinating 30% of the population, you'll get there. If you don't do anything else but vaccinate increasingly, you'll sort of blunt that curve. And again, it's a combination of those things. And the same goes for the ICU admissions. Again, and this is nothing to do with Omicron, really. It has to do with what we had projected would happen when you get Christmas and closing and people are more indoors and so on. So to me, it's important to know, and that's why it's not a time to remove vaccine passports, and it's a time for us to really ensure that we optimally vaccinate everybody and be sensible when it comes to holiday. Keep your gathering small, vaccinate with vaccinated people, make sure you wear masks, make sure you're physically distanced and so on. And that protects you against Omicron as well, which we do believe transmits in the same way as the Delta. So basically, it's very important for us to really continue this last mile of getting the first and second dose as optimal as possible to a 12 plus population. Our third dose strategy, as you may have heard, next Monday, December 13th, 50 plus individuals who are 6 months post second dose will be able to book their appointment and get their third dose. And again, the pediatric vaccination started last week, and that's doing as I showed you very well. We are going to keep it up. I do anticipate that we'll be able to vaccinate probably around half of our population, between 7,000 and 8,000 at this rate between now and the end of the year, which is what we want to do. But they won't be fully vaccinated because they need the 2 doses. Again, just to sort of talk about this, I talked about it last week, but the transmissibility is not clear. It seems to be easily transmitted, just as easily, if not more easily, than the Alpha variant. The severity, not clear, but I've seen some reports that show that most patients don't end up in hospital. Most patients who get it are not vaccinated, and if they do end up in hospital, they get very mild disease. So it seems to be milder, but that's what we're going to wait for. In terms of vaccine effectiveness, it seems to be effective because 87% of the cases in South Africa are among non-vaccinated. So there is some kind of protection there. Again, what we want to do is we want to maximize the number of people vaccinated and bring the third doses up so we can go back to that very high protection to make sure that even if there's a bit of a decreased susceptibility by Omicron versus our vaccine, that we'll be able to at least have a good baseline of protection. Obviously, we continue our measures. And again, Omicron is in Ontario. Last week, we had reported 4 cases. Now there's close to 15 or 16, and there's a suspected outbreak in London, Ontario as well. And basically, at this point, like I said, these are some projections, and it's hard to project with Omicron because, like I said, with or without Omicron, we are facing increased numbers, and we need to vaccinate, we need to continue our public health measures, and so on. But it depends on what it is. If Omicron is more infectious or less effective, whatever, those are different scenarios. But that's speculation. We're just going to wait for the data to come out. And again, just to finish, really, we don't want to lose focus on the fact that, again, Delta is our major threat. I said it last week, but it's worth repeating. In South Africa, the situation was different. Like I said, 75% of the population is not vaccinated. And again, we need to continue, with the first, second dose, get it as high as possible. The third dose rollout, let's get that going. Let's get our 50 plus going. Next year, I'm very confident that there will be likely a diminution of the age. So 18 plus will be able to get the third dose when they're due. And we need to continue, like I said, the 5 to 11 rollout as quickly and as efficiently as we can, and continue the public health measures. Today it was announced that there will not be any loosening of restrictions. And we also strongly urge the government not to remove vaccine passports in January. We don't think it's the time. We think that January, February will be higher months and months where we'll have to really work hard, and then we'll be able to at least reevaluate at that time. So, and obviously keeping up those public health measures. And as I said, in terms of the upcoming holidays, vaccinated people will vaccinated people. Of course, if you have vulnerable people or not vaccinated people or mixed people, you should wear masks. Keep it as simple as possible, as low as people getting together as possible, because those are areas that there's no monitoring, there's no precautions. So that's sort of our message at this point, because we want to make sure that we don't have any surges that will overwhelm our healthcare system. I'm just going to answer a couple of questions that I have here, and then we'll go to questions. Is it fair to say the science doesn't know if Omicron emerged in a vaccinated or unvaccinated person? Theoretically, it could emerge in anyone, likely in unvaccinated situations, because in unvaccinated situations, you have more more chance for the virus and viral load because there's nothing stopping it. With people with breakthroughs, you have a bit of an antibody effect, and you may be able to stunt it. So theoretically, although you could probably get it in both, we see it more among non-vaccinated, or there is a high percentage of non-vaccinated, because the viruses need bodies in which to grow, and that's the time that they mutate. Recently read a report, the Quebec has found deer carrying the virus. Have you heard about this? I haven't heard about deer, but I have heard about other animals. I think a chimpanzee or a gorilla having it as well. So again, not uncommon. We do see interspecies infection with some of these viruses, but I have heard it in animals, not necessarily deer, but yes, I have heard it. Regarding the Omicron variant, have the results of the test? Yes, I just want to talk. Hugo asks about the individuals. We had 3 individuals. To ask if you could confirm where exactly. Okay, I'll ask that later. Okay, so basically, we had 3 individuals that we initially saw. The tests were negative, and there's no Delta. And we had 2 more that were flagged to us, and we're testing them as we speak. So we had a total of 5 in our area, but we have not had any Omicron positive cases. And as I said, for our outbreak, I asked about it, and so far it looks like it's Delta. On a une question en français ici. Est-ce que c'est possible de donner les récents chiffres? Oui, je vous ai donné. Je pense qu'on est rendu à 2750 enfants qu'on a vaccinés. C'est à peu près 16% de la population. Vous avez demandé aussi, tenu compte de la situation météorologique, est-ce que vous avez beaucoup d'annulations aujourd'hui? Non, en effet, toutes nos cliniques hier, en effet, au Winchester, ça a bien été, malgré qu'on avait une tempête aussi, mais à ce moment-là, on n'a rien annulé, mais ça se peut dans l'avenir. Donc, espérons qu'on va avoir du beau température d'ici la fin d'année pour qu'on puisse continuer avec les vaccins, les cliniques de vaccins, et on n'est pas obligé de les annuler. Francis asks me from Senator Freeholder, have the results of the 3? Yes, I answered that. Has the EOHU been? I've answered that as well. Do you believe that the Omicron variant poses a significant threat to the EOHU area? At this point, I don't know. My suspicion is that it causes mild disease. It does respond to vaccines from what we can see. It is more easily transmissible, but the measures that we're using, if we continue them in terms of public health measures, in terms of vaccination, optimizing those, and so on, I think that we'll be able to offset it, even though if it's here. J'ai une question ici encore, ça c'est de Camille du Radio-Canada, au niveau des pourcentages d'enfants. J'ai dit tantôt, c'est à peu près 16% des enfants qui ont reçu le vaccin. Ça, c'est de hier, on vaccine aujourd'hui. Je suis confiante qu'on va aller 45 à 50% d'ici la fin décembre ou plus. Avec les rendez-vous qui ont été pris pour cette même tranche d'âge, le pourcentage monte à combien vaccins reçus et vaccins planifiés? Je peux vous dire que nous avons des places pour au moins un autre 4 à 5 000. Je peux vous dire que la plupart sont pris des rendez-vous. Donc, on envisage d'aller entre 600, 500 à 700, à 6500 jusqu'à 7500 à peu près, qui aurait la moitié de la population d'ici fin décembre. So Jenna, there's something here about Francis Racine. Would it be possible to ask Dr. Paul if he could confirm where exactly the significant outbreak he mentioned was? Could he also confirm the name of the factory? It's in Ingleside. Okay, Jenna, let's go.
Matthew Kupfer, CBC News. Please go ahead.
Hi, Dr. Paul.
Hi.
I'm just kind of following up on some of the Ontario modeling data today. And what that means for, it doesn't even really take into account what impact Omicron might have. But people are I guess people are still nervously looking to their holiday plans. And you're seeing, of course, you're saying the prevalence of cases among the 5 to 11s is still the greatest portion of cases.
No, it's not. It's a 20.
Oh, sorry.
It's the 18 to 29s.
Oh, it's 18 to 29. I apologize.
Okay.
But I guess maybe if I could focus then, just because they are the still to be vaccinated cohort, how does the prevalence of infection among that younger cohort, how does that factor into the way that people should be thinking about the holidays and what we're looking at in terms of these modeling numbers?
That's a good question. If you look at the modeling, okay, we're saying that if we vaccinate at least 50%, by the end of the year, we'll be able to offset and flatten that trajectory. And I'm not talking about Omicron right now. What I don't think that we'll be there between now and the end of the year. Even if we vaccinate 60 or 70% of our population first dose, at least they're partially vaccinated, but they're not fully protected. So I would that's why I would say cautious during Christmas get-togethers or holiday get-togethers. Keep it low. If you got children that are not vaccinated or partially vaccinated, treat them as unvaccinated. So you need to wear masks when you have people from other households, regardless of their vaccination status, and keep it that way. Keep it as low as possible. This is just going to buy us time. It's unfortunate that we're rolling it out now. If we had rolled this out, 2 or 3 months earlier, which wasn't possible, we would have been in a better position. So that's what we're fighting now. We're really trying to buy some time until we vaccinate a significant proportion of the 5 to 11s to add that community protection.
And just one more thing on some of the information from the modeling table. I think you pointed out in your presentation that the EOHU is on the 2-week trend, having an increase of cases. So if I understood correctly, that's mostly related to a single outbreak.
Yes. Yes.
Which is unfortunate, but we were seeing in other, for example, Dr. Moore was mentioning that in Windsor they had issued some instructions. Is that something? How are you weighing the possibility of, if that trajectory continues, of issuing other? Sorry, ahead of the holidays.
Yeah. Certainly, we're going to be looking at the trajectory, looking at the numbers, and looking at where the cases are coming from, and if there's community spread, we don't have any, and our number, which is now lower than 1, the reproductive number. So we're going to look at the indicators, and if we do need to issue an order like they have in Windsor, like I think they're doing in Kingston, that they've done in Sudbury, we will do that at a regional level. At this point, I don't see the need, but certainly we're looking out for that. And in the absence of that, I still recommend that people keep their numbers to a minimum when they get together with other household members, just to be on the safe side. Again, because we have that unknown on top of it all now, which is the Omicron.
Thank you, Dr. Paul. Do those joining by phone have questions? Press *6 to unmute. Ceux qui se joignent par téléphone ont-ils des questions? Appuyez les touches étoile 6 pour désactiver le mode silencieux. Those are all the questions for today, Dr. Paul.
Thank you.